After I explore that surface, I want to do the mesial surface of number 9. So I could stay here to be productivity. I could just stay in the same position and do my mesial lingual instead of changing clock positions, and I should. So I'm going to stay on my lingual surface. If I just use the 11 end to do the distal lingual, it would be the 12 end to do the mesial. So again, I want to get my bearings, get my fulcrum, make sure it's the right wrap and check it before I start. Start a little mesial to the midline. This view is kind of hard to see with the camera, as easy as a facial view. But I want to end right there, going interproximally, up and down lightly. The corner of my incisal edge is showing. My grasp is relaxed and light, and I don't feel any calculus. Then the last surface to do is changing back to my facial surface. So I go back to my near position, which is 8 o'clock for a right-hand operator, chin's up still. My light's at 45, my bracket table is close. My non-dominant hand can go back to just retracting with the lip. I'm going to start on the midline of the tooth, get a nice tall fulcrum on 10, get my grasp nice, see that I can pivot before I start, would be a nice thing to do to see if I can swivel. I feel comfortable to be able to do that. I'm going to take your lip back and hold it a little bit firmer back so that you can see better. Start again, not right at the midline, but distal to the midline. Start going sub. Take my tip lightly and slowly, small little strokes, millimeter apart. Roll my grasp as I'm coming around the corner, line angle. Roll, roll, rock, rock, pivot. Go lightly interproximal. Stay under interproximal and count 1, 2, 3, 4. Mentally, if that makes it where it's possible to get good coverage. And notice how as I explore, I'm following the junctional epithelium curves up the way the sulcus would be. Doesn't go straight across. So I'm basically having to make small little strokes to follow the contour of the sulcus and to stay right there to find calculus. Real light. And again, check my grasp to see if my grasp hasn't been compromised. I still have plenty of space when I'm finished between my thumb and finger. Okay.
The 1723 Explorer with the 17 end, tooth number 7. Held the Explorer with a light modified pin grasp, maintained an appropriate fulcrum on occlusal or incisal surface, same arch, close to working area with light pressure, positioned handle shank as parallel to the tooth as possible, used correct end of Explorer, and for this Explorer, that's a single-ended for using for anterior teeth. Adapted the working 1/3 or tip, 1 to 2 millimeters of the tip on the tooth. Use short, even, vertical or oblique overlapping strokes. Activated stroke with wrist action.
On the 17 end, in order to do the distal, I'd have to say that's my near surface. It's a far surface for a left-hand operator, but it's my near, so my right-hand operators would say I'm at the 8 o'clock position. Lefties would be at the noon position. I would also then say my patient's chin needs to be up and slightly away from me, and if the patient can go up as high as you can, it'll make you land a nicer neutral wrist. If the patient is not quite up, Aaron, if you want to go down just a little bit low, when you land, you're already bent up and crimped. So make sure the patient lands at your best advantage. A little higher, Aaron, thank you so much. And then make sure that you're trying to get that surface where you can land a nice neutral wrist. Then what I also want to do is tell my patient, my next thing is my equipment. My light's at 45, my bracket table is close. Then I could use my retraction with my finger on the facial. So I want to retract for the distal facial. My non-dominant hand has a fulcrum. It's not just retracting, but it's actually stable, so it can't flop over the lip. Then I want to get my nice C-shaped grasp. You guys can put a index finger and thumb across from each other, middle finger on the shank, and the ring finger extended. And with this instrument, the common thing is to make sure that this terminal shank, as you're turning around the corner, pivots and turns so it stays parallel and doesn't come laying across the tooth. So what you want to do is you want to land a nice fulcrum, get it again a little bit mesial to the distal line, or the midline, I should say. Go little small zigzagging strokes. Come around, and here's the key right here when the camera watches the ending. Can you see how when I'm doing the ending strokes like that, that my terminal shank is as tall as it can be to match this long axis? Here's an incorrect technique. I start off at the midline, but as I come across, I'm not quite aware of my terminal shank, and I come straight across the tooth, and I feel like I'm exploring, and I feel like I'm doing a pretty good job, but you can see how that would not be parallel to the long axis of the tooth. The terminal shank should match the way the root is shaped, and the root is narrower than the crown, so this is the angle that the terminal shank should be. Then I want to do my lingual surface. Take a mirror. Patient is in the same position. I'm in the same position. I want to take my mirror and land it. Fulcrum should be around 4 or 5. I can see indirectly to make sure I can see it first. If it fogs, which it did a little bit, I'll tell my patient if you could breathe out of your nose, please. Clear your mirror. Land a nice fulcrum. Again, start at the midline. Make sure I have the right end. Start at the midline. And again, little tiny strokes, coming all the way around, taking my time, pivoting, turning, and then going very light. 1, 2, 3, 4. Wrists are neutral, both wrists are. C-shape still is maintaining, fingers are together. Then I want to do my far surface, and so what I should do is I can sit in the same position. I would have to, I would have to turn if I'm doing my mesial surfaces, but the patient's in the same position. I'm at noon for my far surfaces. My chin is up. My patient's toward me a little bit. I can put my mirror down, bracket table close, light at 45. My non-dominant hand can retract. I can start a little bit distal to the midline. Rock, roll, pivot, go light, go slow, take your time. And then right here, watch the ending strokes. And check yourself as you're exploring. The teacher sees what we see, and you see right here at the end, that I'm going light enough and I'm going under the interproximal, so I actually only should see my terminal shank at the end. The rest of the tip is under, while only 1 millimeter of it is touching the tooth itself. Patient should feel pressure, but they shouldn't feel pokes. And then at the end, check your terminal shank to make sure it didn't come straight across the tooth that way. Okay. Then I want to do lingual, so I grab my mirror, get a fulcrum, tooth number 10, to look at tooth number 7. Grasps are nice on my non-dominant hand. Again, it fogged just a little bit, so I'm going to clear it. Go look at it again. Get my dominant hand grasped nice. Land on number 6 incisal to do number 7. Start a little bit mesial to the midline. Little tiny small zigzag strokes. Take my time with the mirror. I'm still pretending that I can feel the curve of the tooth at all times. Tactily feeling it come around. My posture isn't compromised. I'm not stooping this way. I'm still neutral, relaxed. If I have to say to myself, recapture your posture, you can say that. Come across at the end, interproximal, light, 1, 2, 3, 4. Again, a good thing to do is just check your grasp and make sure you're rolling, rocking, and pivoting, and your fulcrum does a swivel action like this to adapt. On this proficiency, we use this end for one tooth, we use the 23 end for another separate tooth, and then we use the 11, 12, and 3CH for both an anterior and a posterior. And the last end is
the 23 end of the 1723 Explorer on the occlusals of tooth number, tooth number 30.
Okay, so tooth number 30, the main thing with this end is that you're obviously not doing near and far positions because this instrument doesn't have a near or far surface, it's the occlusal surface. You just want to make sure that you get a stable fulcrum, whether you're on the upper or the lower, and that you can check all the occlusal surfaces. If the anatomy has a buccal pit or a lingual groove, you need to check that also. You always want to stay perpendicular to the tooth, and if there's just suspicious class 5 decalcification areas, you want to go around the gum line. And you're never checking this instrument for calculus at the gum line, you're checking it for class 5 caries. So in this case, I'm going to retract on number 30. My non-dominant hand, chin is down. I would choose to be as a right-handed operator for number 30. I'd be in the 8 o'clock position. I'll have a fulcrum so I can retract and visually see number 30. I want to land a stable fulcrum because I'm going to be putting pressure on the tooth in a downward motion. So I want to make sure I'm stable and I'm not going to slip into the floor of her mouth. I'm checking around. In this case, our patient has an occlusal composite and it extends into the buccal groove. So I can tell by the feel of the composite that it's glassy and not like a tooth. But I'm checking around the margins of the restoration to make sure they're intact with no deficiencies or ditching. And then I'm also checking the buccal groove. It looks good. I'm checking class 5 areas around the root. There's a little recession, but there is no problems with any class 5 caries. I'm looking on the lingual of the same tooth to make sure I don't see any suspicious class 5 decay there as well. And there is not. Still have a fulcrum at all times and still have neutral risks. And it's good. And that concludes the PE on exploring.